Hi folks, Dr. Hagmeyer, and I've received many emails asking me if I would do a video about panic and anxiety disorders and some of the most common metabolic causes behind them. And because this is such a common problem experienced by so many people, I also want to talk about what I feel are some of the missing links in the treatment for people with anxiety and panic disorders. Now, the information I'm going to share with you in this video has helped thousands of patients over the years and will help you understand how a holistic approach can literally give you light at the end of the tunnel. Okay, so if you've been diagnosed with anxiety disorders or panic disorders, I want you to realize that while at times you may think that you're the only person suffering, what you should realize is that it is the most common type of psychological disorder that people suffer from. In fact, it's so common that anxiety disorders affect about 6 million American adults. Now, just to give you some sort of perspective, I live in the city of Chicago, or the Chicago suburbs, and I will tell you that Chicago has a population of about 2.5 million people. And so if you can imagine a city, okay, almost 3 times the size of Chicago, or a city almost the size of New York, and just for a moment imagine that every single person, every child, every man, woman, and child in that entire city suffers with panic and anxiety disorders just like you, you'll realize that you're not alone, okay? So while it points out that these numbers are staggering, what's more important is to understand is that we have a huge problem on our hands that cannot be fixed with anti-anxiety pills, okay? Now, whether you're a man or a woman, anxiety and panic disorders can be quite scary, okay? Now, in every effort of trying to get to the root cause of what's causing your anxiety, you may have bounced from doctor to doctor to doctor, hoping that the next doctor or the new doctor will do something different. But every new doctor really only increases your medication, adds more medication, or changes the kind of medication you're on. And while the prescription pad can be extremely helpful at times in alleviating some of these symptoms, in a very short period of time, your brain habituates. The receptors of your brain get used to the medication, and now you're back to square one. And this becomes a medication merry-go-round where your doctor is trying to dial into a cocktail of different kinds of medications for you. Now, with all this being said, I want to get into some of the most common metabolic causes of anxiety and panic disorders that I regularly see in my practice, and the things that you can do that will help eliminate or correct your anxiety disorder naturally. The first area, if you're experiencing anxiety, depression, panic disorders, that you're going to want to consider is your sex hormones. Okay, now your sex hormones are things like estrogen, progesterone, testosterone. These all have an influence on brain and nerve function, okay? Women are twice as likely to suffer from panic disorders than men, and so if you're a woman watching this and you experience symptoms like an alternating menstrual cycle where the length of your cycle is either shorter than 24 days or it's longer than 32 days, or you have pain, you have cramping, you have heavy bleeding, you have acne, you have facial hair, you have hair loss, you have hot flashes, you have mood swings, or you don't have a period, okay? Let's say you have PCOS, or you've been diagnosed with PCOS, which is cystic ovaries. You have endometriosis, you have fibroids. All of these names, all of these conditions at the very root are a hormonal imbalance. And if you have these, and if you have anxiety, then this hormonal component to your anxiety, to your depression, to your brain fog needs to be further investigated, okay? Now, due to the link between estrogen and serotonin, women are, without a doubt, especially susceptible to mood disorders, okay? Whenever you have a sudden drop in estrogen levels, like when it happens just before you get your period, you may notice that your anxiety gets worse. Some women during perimenopause or during menopause itself also notice anxiety gets worse. Now, this is you. Don't be so quick to rule out that your sex hormones are balanced, okay, or that they're not contributing to your anxiety. Now, take, for example, this diagram that you see here, okay? What you're going to notice is that between the ages of 35 and 50, a woman can have as much as a 75% reduction in her progesterone levels, okay? Now, this is important because this imbalance, this progesterone and estrogen imbalance, can affect the brain in a number of ways, okay? It can affect the number of serotonin receptors in the brain itself. Okay, and as you know, serotonin is the neurotransmitter that helps you feel good. It helps you feel happy. It basically has a calming effect on the body. It's a natural mood stabilizer. and it has an anti-anxiety effect on the entire body. The second area is it can affect the endorphins that are produced in the brain, and these are the opiate-like chemicals that are also part of helping you feel good, okay? Now, the next imbalance is one where you actually start to see a condition known as neuroinflammation or oxidative damage that can lead to premature aging of the brain. And as you know, aging of the brain causes a less effective brain to produce the neurotransmitters that it so desperately needs. Things like GABA and serotonin and dopamine, okay? Pregnancy, okay? High levels of estrogen obviously can improve mood. But right after a baby is born, estrogen levels drop, and they drop very quickly. And in some women, this drop-off causes less serotonin to be in the mother's brain, and this can be a catalyst for postpartum depression. And if you watch any of my other videos, you know that there's a connection between serotonin and dopamine levels and thyroid disease and thyroid problems, or functional thyroid problems, which is also something that shows up postpartum for many women after delivering a baby. So not only do we see estrogen affecting serotonin and dopamine levels, we also know that when the body's under stress, the body responds by increasing your cortisol level output from the adrenal glands. And this brings us to the next connection that anxiety and mood disorders have with another system in our body called the fight or flight system called the adrenal glands, okay? Now, cortisol has what's called a diurnal rhythm, like the one that you see here in this graph, okay? Cortisol should peak highest in the morning hours, and then as the day progresses, there should be a steadily decline throughout the day with the lowest levels of your cortisol being at night, just before you go to bed, okay? Now, that's not what we see in people that suffer with anxiety. Very often what we see is we see high levels or elevated cortisol levels throughout the day. And we see these elevated cortisol levels, especially at night, for those people who suffer with insomnia. So if you can't get to sleep at night, you're tossing, you're turning, it's very important to have this test done. Now, if you look at this diagram, what I want you to pay attention to, and some of the things I want to point out to you, is all the things that your adrenal glands play a role in. This is why it's so important that when you look at anxiety or depression or any other cognitive or brain problem, that you need to look at the big picture. Okay, what you're going to notice here is at the very top, you're going to notice this orange circle. And you see that cortisol levels here influence your carbohydrate metabolism. If you look at the green circle, you're going to see that cortisol levels and DHEA levels also regulate inflammation. And I'm sure that you've heard of cortisone shots because anybody with chronic pain, whether it be shoulder pain or knee pain or back pain, they may have received a cortisone injection. Okay, and that basically means, or that chemical or that hormone has an anti-inflammatory effect on the body, decreasing pain. So this cortisone brings down inflammation in the body. But what happens if your body doesn't make this hormone because your adrenals have been just fried, as in the case of adrenal fatigue, or a more severe state of maladaptation of the adrenal glands? How will inflammation be kept in check? And the answer is it can't. Your brain, your blood vessels, your heart, your thyroid, your joints, your muscles, all of these things are so sensitive to inflammation that if there is inflammation, you can't expect any of these to work properly. In fact, not that long ago, Time magazine featured an article on the front cover titled "Inflammation, the Silent Killer." And it showed the link between heart disease and Alzheimer's, but also the link between inflammation and things like diabetes and inflammation and cancer, and just that link that exists. And we're seeing this problem, this inflammatory condition, be so prevalent in people with autoimmune diseases, okay? Low cortisol, let's talk about that for a moment. Low cortisol, like that seen in more of the extreme cases of adrenal fatigue, is also associated with low blood sugar. In fact, if you have any kind of blood sugar problem, you want to have your adrenals tested like the ones that, like the test that you see here. Blood sugar has an important connection to anxiety and brain function. Anytime we have too much or too little blood sugar, this can have a massive impact on the way amino acids are actually transported into the brain. And as you know, that can have a massive impact on your neural health, memory, learning, sleep, mood, function throughout the day, okay? This is again because cortisol can impact your GABA levels, your serotonin levels, your dopamine levels, and all of these neurotransmitters that are so vital and important to everyday function. And again, this is why it's so important to get checked and have your adrenal glands checked through a salivary test, okay? Now, a blood test. A lot of people ask me about blood tests and salivary testing. A blood test is still a very accurate way of assessing adrenal function. The only problem is that with a blood test, you're going to miss some very valuable times of the day or snapshots of the day where your cortisol levels could be low. So if you're just having a one blood draw center, you won't appreciate the information that comes back on a saliva test, because the saliva test just shows us so much more compared to a blood test. So now we've covered sex hormones, we've covered adrenal hormones, we've covered those impacts on anxiety. I want to talk to you about the third area that really needs to be evaluated, and this is the connection that anxiety has to the thyroid gland, okay? Every cell in your body has thyroid receptors and responds to thyroid hormones. Your heart, your brain, your lungs, your reproductive system, your blood sugar, all controlled and influenced by the thyroid gland. This is why men and women that suffer with thyroid problems can have things like anxiety, they can have depression, they can have hypoglycemia, hyperglycemia, many other problems associated with brain fog as well. The problem when it comes to thyroid disease is that it is one of the most commonly misdiagnosed hormone disorders in the world today. And this is largely due, for the most part, because of the way most traditionally trained endocrinologists and general practitioners test the thyroid. It has to do with the lab ranges that they use and they've come to rely upon, and it comes down to the fact that if it looks like you have a thyroid problem, everybody goes on thyroid medication. And if you're watching this and you have been diagnosed with a thyroid problem, there's a very good likelihood that you're not feeling much better on thyroid medication. And some of the things that we're talking about in this video are the missing links, okay? So one point that's very critical that I want to make clear today is that normal levels of thyroid hormone don't necessarily mean that you have optimal and healthy thyroid function. So if you suffer with thyroid disease, you probably know firsthand what happens when your thyroid medication is off. When the thyroid's off, your mood's off, your focus is off, your sleep is off, your concentration is off. And without a doubt, in almost all the patients that I've seen and worked with over the years, either some degree of anxiety and depression exists. Okay, this is a common denominator amongst all of them. So it's very important that you get these properly tested. Whether you suffer with anxiety or depression is largely going to be dependent upon your T3 levels and your T4 levels. Okay, it's very important to have both T3 and T4 levels tested. If you have an overactive thyroid because you're either being over-medicated or because you have hyperthyroidism or you have an undiagnosed autoimmune thyroid known as Hashimoto's, you'll experience symptoms like nervousness, restlessness, anxiety, irritability, inward trembling, insomnia, and racing thoughts, okay? And this has to do with the high levels of T3 and T4 that's often seen with these conditions. Now, on the opposite side of the spectrum, on the opposite end of the thyroid spectrum, is a condition where your thyroid is underactive, okay? Now, this again can be an autoimmune condition where, again, Hashimoto's is disguised as low thyroid, or it could be that the fact that your body's simply not converting T4 to T3. And this is also known as low T3 syndrome. Now, if this is happening, you may experience fatigue and brain fog, loss of focus, loss of concentration, bouts of depression mixed with anxiety. So here's where you're going to want to work with a holistic doctor who will properly test your thyroid, looking at a variety of different thyroid markers that will pinpoint whether or not your thyroid is truly a part of this anxiety picture, okay? The next thing is, when it comes to anxiety, again, the anxiety that's linked to thyroid problems, the adrenal problems, blood sugar problems, these can all be linked, again, with sex hormones. So again, there's a lot of different causes that are behind this anxiety and depression, okay? So this is why it's so important. Just don't resort to taking medication right away. Work with a doctor who's open to either working with a holistic doctor who will take into consideration many of these things before you simply go on medication. Now, another important area of consideration when you suffer with anxiety and panic attacks is neurotransmitter synthesis. And this is a big part of dietary consumption, digestion, and the absorption of the proteins that we eat. My opinion is that whenever a patient is experiencing anxiety and sleep disorders, depression, loss of focus, excitability, it's so important to look at an amino acid profile. Here's why. Amino acids are the breakdown products of protein metabolism. They're the building blocks that produce thyroid hormones and all of the neurotransmitters like serotonin and dopamine and GABA, and even the sleep neurotransmitter known as melatonin. All the tissues in your body are made from proteins. So if you look at this illustration, the neurotransmitters that you see in this diagram can be classified either as excitatory or inhibitory. And high levels of excitatory neurotransmitters like norepinephrine or epinephrine, glutamate, and dopamine, they can all have an effect on your body where you feel jittery or panicky or have that inward trembling. The same can be said if you have low levels of calming or the inhibitory neurotransmitters, things like serotonin or GABA, gamma-aminobutyric acid. Low levels of GABA can cause feelings of anxiety, in addition to restlessness and tension. And this is often why doctors resort to pulling out a prescription pad, and they're very quick to put you on something like Xanax or Lunesta or Ambien, okay? Now on the flip side, if dopamine levels in your brain are too high, again, dopamine's excitatory, you can also experience anxiety and fear and inner rage and panic attacks. Now this might happen if you're being over-medicated with the medication that increases dopamine levels, okay? So this is something that you have to work with your doctor about. Now, there are many things that influence the way these neurotransmitters act on the body, and it's important that we realize that it's important for us to understand why we may have too much or too little of these neurotransmitters. Sometimes we can't make enough neurotransmitters because there's too many fluctuations throughout the day in our blood sugar, or because there's neuroinflammation, perhaps because we have a leaky gut, or we just have a bad diet, we're consuming a lot of sugar, and so we have these surges of insulin. Now there's a huge connection between how these amino acids get transported into the brain and our body's insulin response to sugar. Too much or too little sugar affects our brain from making neurotransmitters, okay? Now what's important is it doesn't stop there. It's not always a deficiency of a particular neurotransmitter that's causing the problem. In some cases with anxiety, I'm often suspicious of a genetic defect of the GAD65 enzyme. And this is something where if you have anxiety, I think this is something that everybody should get tested for, okay? GAD65 stands for glutamic acid decarboxylase. And this is an enzyme where, whose job is to convert glutamate, which again is an excitatory neurotransmitter, and its job, that GAD65, is to convert glutamate into GABA, which has a calming effect on the body. Some people's immune systems can attack this enzyme, leading to low levels of GABA and high levels of glutamate. And so you don't want to have high levels of glutamate. Start reading your food labels. Avoid those things with glutamate in them. Avoid those things with glutamic acid. Watch out for hidden sources of monosodium glutamate. Some of the hidden names that food manufacturers have disguised as MSG, okay? MSG is extremely toxic to the neurons in your brain. Tryptophan and tyrosine. Again, these are amino acids that are needed to be transported across the blood-brain barrier. Okay, in the brain, tryptophan gets converted into serotonin, and tyrosine gets converted into dopamine. But sometimes these amino acids, tryptophan and tyrosine, they can't cross the blood-brain barrier because of something called a large neutral amino acid transporter. And many times, this large neutral amino acid transporter can be affected by certain vitamin cofactors that we're either missing in our diet, or sometimes our bodies are not breaking down those proteins into amino acids. And this is, again, why an amino acid profile that I mentioned earlier can be so helpful. This is also why gut health is so important, because if you're not digesting those proteins, they're not available to the body, okay? So the point I'm trying to make here is that it's not only a neurotransmitter deficiency that you're dealing with, okay, when it comes to the metabolism of proteins or digestion or autoimmunity or any of these other things. You have to look at the big picture. This, again, is why working with a holistic doctor will be so helpful to you. This is the very, very different approach than just whipping out a prescription pad and giving you an anti-anxiety medication. Now, with all that being said, it's very important that if you're taking these medications, that you never, ever, ever quit taking them without the guidance of your prescribing doctor, okay? So don't try to just stop taking these on your own. The next area that can have just a massive impact on brain health, and you're hearing so much more about this day in and day out, is the health of the gut, okay? Now, most people wouldn't necessarily automatically think about the health of their gut when they think about psychiatric health or cognitive health or brain function. Part of the problem here lies that when it comes to any health problem, we don't look at the body as a united system. We don't look at it holistically, but we look at it instead as a bunch of individualized, compartmentalized systems. And then when treatment's rendered, it's rendered to a part of the body where the symptom is, and that's an outdated approach to maintaining, correcting, and restoring your health. In my clinical experience, outside of the adrenal glands and blood sugar levels and thyroid hormones and male and female hormones, the gut is a major, major player for people suffering with anxiety, panic attacks, and depression. Many studies have clearly shown a link between depression and the kinds of gut bacteria. Other studies have shown that the gut or inflammation in the gut causes brain deterioration. Other studies show that there's a connection between the microbial balance, that gut flora that gets disrupted when we take antibiotics. There's a connection of that microbial balance and anxiety. Other studies these days show how food sensitivities like gluten and corn and dairy and oats and yeast can induce inflammation in the brain. Studies have shown that gluten can decrease the what's called blood perfusion to the brain, meaning that there's less blood flow or oxygen getting to the brain. So again, there's a lot more to this picture than just taking Ambien, Lunesta, or Xanax, okay? So if you suffer with anxiety and depression, you owe it to yourself to work with a functional medicine physician who understands all of these connections that we've just talked about today. Just as a quick summary, in this final diagram, you're going to see these are the 5 main areas that I investigate when I work with patients who experience anxiety, depression, or other psychiatric challenges. And if you address these, you have a great chance of getting your life back and restoring mental health. So there you have it. I know we covered a lot of information today in today's video, but more importantly, I hope that it gives you a sense of just some of the things that you should be looking at if you suffer with anxiety and you want to get well, okay? If you feel like you've been trapped and you're a prisoner in your body, I want you to realize there is so much more that you can do, okay? Your health doesn't start or end with a prescription pad, okay? You need to make dietary changes, you need to make lifestyle changes, you need to take supplements that are specific to your problems, and you need to help support your body's biochemistry. Don't spend the next 5 years getting sicker and being put on more medication. Give our office a call. Let's get you tested for these things and then develop an approach that's going to help you get your life back, okay? You deserve that. Until next time, I hope you found today's video helpful. Take care.